Okay, so today we're going to talk about thoracic outlet syndrome and how do you know whether you're starting to get this. My name's Dr. Ron Miller. I'm one of the specialists here at Pursuit, and had a couple of cases recently that are we catching it early enough so we can prevent it from happening. But what are some symptoms and how are you supposed to know whether you have thoracic outlet or not? So first off, normally it's with someone who has repeated overhead motion. So whether you're a thrower athlete, a pitcher, javelin thrower, or you're lifting a lot of weights doing overhead presses, normally there's some sort of trigger. It's an overhead action that's starting to trigger this, okay? So some of the symptoms to pay attention to is that you're gonna have this dull achiness right through here. You'll have a lot of tension or tightness along the side of the neck. Okay, not the back, but more of like the side. You'll just feel like it's achy, like right here. Sometimes you'll also feel like chest pain, or like, man, it feels like there's something like right in like the side of my chest, but there's nothing there, but you'll feel this achiness here. And also with the front of the upper trap, not like upper trap pain like it's causing a headache or you're working at an office desk, but you'll feel pain in this area that normally never goes away. Sometimes you'll also have numbness and tingling, like your arm falls asleep a lot. That's another common symptom. And another thing that I also noticed is that when you take a deep breath in, it'll increase this pain. These are all the signs and symptoms that you may have the early onset of thoracic outlet. And this is one of those things that you want to solve it in the acute phase and don't let it turn into a chronic phase, because then it becomes a problem. Okay, so another thing that you'll also notice is that you'll just be frustrated. It's like, man, why is this pain hurting? And you'll start to stretch it. You'll do like a stretch like this, and you're like, okay, I'm gonna see if this helps, and it actually doesn't help. Sometimes it even makes it worse. Or you'll try like a pec stretch. You'll try all sorts of stretches, and you're like, let's see if this works. Let's see if this works, and the pain never truly goes away. Okay. Another test of it is, if you lift your shoulder up, like say breathing hurts, you take a deep breath in and a deep breath out, and you feel that pain there. If you elevate your shoulder and you breathe in and you breathe out and it doesn't hurt, that's another validating sign that you have this early onset of thoracic outlet starting. How do I know this? Because I'm actually going through it right now. I think I actually have a case of this, where I was doing an overhead shoulder press workout. It's been building up for the last 2 months, but I've been staying on top of it. And I've been noticing that I've been getting this ache here. I've been treating it and it goes away. Recently I did this supersetting shoulder press workout, and all of a sudden it came back. I noticed all these same symptoms: neck tightness, deep ache here, taking a deep breath in and out, it hurt. I was like, what is this? And I noticed that my arm was falling asleep. So I'm able to take advantage of this now, do treatment now, make sure it goes away, so it doesn't turn into a chronic state, because it's one of those injuries like plantar fasciitis, tendinitises, thoracic outlet that you don't want to get to that chronic state. So these are some signs and symptoms to look forward to pay attention to if you may have thoracic outlet. If you're coming up positive on some of these symptoms and you're looking for a place of treatment, we see a lot of cases like this. Just give us a call or visit us at pursuittherapy.com, or you can call or text us at 407-494-8835. Thanks.